Let's now cross to Baltimore in Maryland and speak to Dr. Paul Spiegel. He's the director of the Johns Hopkins Center for Humanitarian Health. Thank you so much for being with us, Paul. I want to ask you firstly about, the situation in Gaza. We're seeing reports of famine-like conditions. What is immediately required for the people of Gaza? Of course, food is an issue, but fuel, of course, to prevent bakeries closing, as we've heard in the reporting there, to allow wells and desalination plants to operate.
Yeah, unfortunately, a lot is required at the same time. So certainly, as we've said, food is required. Food had been getting in during the ceasefire after a long period of not having food, and now with bakeries being closed and the people have such a precarious food security to begin with, this lack of food is going to cause once again more acute malnutrition and illness. A very, very big concern is the lack of electricity for the desalination plant. There's over 600,000 people now that are not going to be having clean water. Nearly 1.8 million people already have poor access to potable water. And this is going to cause increases in diarrheal diseases, particularly, and other epidemics. It's also very cold, as we've heard. Children have been dying of hypothermia and newborns. So there needs to be fuel, there needs to be better shelter, and there needs to be clothing. And then finally, from the medical point of view, there is a lack of oxygen there. There's a need for at least 24 generators so that the hospitals can function properly.
And Paul, what are the longer-term public health consequences of the blockade continuing, of all of those basic supplies staying out of Gaza, as you mentioned?
So early on, since October 2023, there's been, as we know, a tremendous amount of bombing, and there's been a lot of deaths, a huge amount of deaths due to trauma. This, although we saw there that there was a drone strike and that there were deaths due to trauma, what we're seeing and will see now is an increase of what we call not a very nice name, but indirect deaths. So it's not direct due to trauma, but there's going to be increasing number of deaths that are due to lack of food, water, electricity, increase in epidemics, acute malnutrition. So that's what we expect to be, what we expect to already be happening, until it will continue to get worse over time.
And also you mentioned the cold as well, and people dying from hypothermia. I mean, what needs to happen there as well? People need clothing, they need shelter, those sorts of things too?
That, and they need, of course, fuel. I mean, what happens is why newborns are dying is because they have very little fat to begin with, and you need incubators. You need functioning incubators in hospitals, but there's a lack of fuel and there's a lack of incubators available. So the most vulnerable the population, which is primarily newborns, children under 5, and the elderly, will continue to suffer from hypothermia. So yes, it is fuel, it is proper housing, and even if tents, I worked previously with the UN for many years, and the tents that are quite thin, that are not made for these winter conditions. So different types of shelters and, of course, winter clothing.
And Paul, obviously, we're meant to be in a ceasefire, but as you mentioned, there have been strikes killing people, and that's causing trauma, which is killing people. But can you elaborate a little bit more for me about how the numbers of deaths and types of deaths will change despite the bombing mostly having stopped?
Yeah. So for most conflicts, what happens is that at the beginning, when there's an acute conflict and there's a lot of as we said, bombs and missile fire, etc., you have an increased deaths due to trauma-related war deaths. And that's what we did see in Gaza, and we still see for now, sadly, for a long period of time. But so now that we have a ceasefire, and then there are still some deaths due to trauma, it's going to be these indirect deaths that are going to be amongst weakened population that just do not have sufficient capacity both whether it be for food and as the cold as we've spoken, but also be able to access both healthcare, primary healthcare and hospitals. And so we'll see a significant increase, or let's say proportion of deaths from people that were previously dying from trauma. Many will still die from the wounds that they've received during trauma, but then we'll see a lot of deaths occurring due to non-communicable diseases. We'll see deaths due to, they have been occurring in the past, but they will continue and grow, lack of medications, so coronary artery disease, diabetes, those that need renal dialysis. All of these medical conditions will sadly increase, and we'll see more deaths due to what we euphemistically call indirect deaths.
Dr. Paul Spiegel, Director of the Johns Hopkins Center for Humanitarian Health, thank you so much for your time.